Okay, we're convened as a work session. And first up is environmental public health fee schedule adjustment proposal. And Jeff, I believe you're here to inform us about this one.
Yes, good morning, counselors. Jeff Harbison, for the record, I'm the Administrative Services Director for Clark County Public Health. As you stated, we're here to get guidance, receive guidance from the Board of Health for an update to our environmental public health fee schedule for 2026. All right, I'm going to be bringing the ordinance forward at the August Board of Health hearing this year. Previously, it had been in September. So at this presentation, we'll go through the background, a fee model proposal, and then next steps. Next slide, please. All right. Our environmental public health fee revenue, it funds activities in all the programs you see before you, our 2 drinking water programs, recreational water, on-site septic, food safety, school health and safety. Next slide, please. All right. I do want to add here that our process for environmental public health fee calculations, it's been reviewed by the state auditor's office at least twice, and we've been given a clean bill of health both times. Our fees are calculated strictly to align with projected program expenses, less any program income. There is no profit margin built into these. These are strictly covering our costs. From 2011 to 2018, the program costs, the general fund basically covered what was deemed greater good. Greater good, you'll see listed there, things like it's work performed but not really related to a permit or a fee or a license, residential waste, complaint investigations about food establishments, and then any like foodborne illness or waterborne illness outbreak investigations. Is that better? All right. So the 2017-18 biennial budget, that was the last year of the general fund supplementing fees for the greater good. You'll see an increase there of fee revenue of 1.35%. Beginning in 2019, the Board of Health adopted the policy to move back towards full cost recovery for these fees. The general fund was it's expensive to cover all the greater good, so the general fund was no longer able to really sustain that. You'll see some larger increases there as we went on that journey, 2019 through 2021. Where we're at currently is where we landed with the 2021 fees, and that was 100% cost recovery, except for 2 programs, drinking water protection and on-site septic permitting. And they were set at 90% cost recovery. And the rationale for that was to maintain some level of funding during times of an economic downturn. Those 2 programs are very strictly tied to construction in the community. In 2008 through 2010, those programs were pretty much decimated, and it didn't really generate enough revenue to even get that greater good completed. So you'll see there 2022, 3.19, fees went down slightly in 23. 25 was an outlier with 11.69%, mostly related to the Baker-Tilly salary realignment study exercise. Next slide, please. So we had one-on-ones with each of you in June. We've met with our Public Health Advisory Committee. We've met with technical advisory committees with industry, on-site septic, drinking water, food safety. And at each of these, we presented the 3 options, the 3 scenarios we brought to the one-on-ones. And like in the one-on-ones, the individual feedback and the feedback from the tax, scenario number 3, which is the lowest fee adjustment of all 3. And it's also where we use some of our department fund balance to mitigate the fee adjustments. That was the preferred option across the board. So this is the proposal I've got today. It It increases fee revenue only by 3.86%. You'll see there the increase in revenue by program. I added, after the one-on-ones, I decided to calculate the percent change in fee weighted average in the right there in light gray. School health and safety, you'll see an 18.04% increase in revenue, but actually the weighted average in the individual fees is going down 19.4%. And what that is we've got higher volume expected. So while fees are going down, the volume is going to be increasing. There's during the state process, it was some clarity given to these environmental health assessments the schools need to do. They're actually required. They are mandated. That was not quite that clear. So we're actually forecasting greater volume in that activity. So this is the proposal for 2026 fees. What we would be looking for today is any guidance if you'd like to see another model brought forward in the ordinance in August. You can actually go to the next slide. I'll talk a little bit about. I did want to cover some notes of interest. Scenario number 1 and number 2 at the one-on-ones and with the tax, they had 15+% and 17+% fee increases. We opted, and the feedback was that scenario number 3, where we're offsetting that with fund balance. Some of the reasons why the scenario 1 and 2 were going up, the Me Too grievance, we saw our field staff, the average field staff salary costs up almost 16% year over year. As well, medical insurance costs, we're seeing an increase of just under 14.7%. The transition of solid waste from public health to public works cost us, or it impacted our budget about $400,000. Some good news, I want to include everything. The Washington Department of Retirement Services was able to reduce the employer portion of our pension costs from 9.1 to 5.58% effective this last July 1st. That reduction in cost actually more than offset the cost of transitioning solid waste. So that was actually some great news for us. But that last note, without the application of our fund balance, fee revenue would have been proposed to increase 15.23%. So this temporary approach where we're using our department fund balance to offset those fee adjustments, that's the preferred option, I would say, across the board.
If I could just add something really quick, I do believe for the Me Too costs, there actually is some funding that's set aside already to cover some of those impacts in the budget. So I'd encourage you to work with Emily. And then also the move to solid waste, there may be a hit there, but I think there's savings actually in public works that we can realize as well. So they're still working through that process. So I don't want council to think it's completely skewed one way or another. So thank you.
Yeah, I'm just referring just to the impact on public health. That's a great point. Yeah.
Sure.
Yes, go ahead.
Thanks for all this good information. In August, I think it would be helpful to have, in addition to these percentages, because the percentages to me don't have a grounding. I can't wrap my head around what the impacts would be to the folks and the entities that are have fees. So I guess what would be helpful in addition to this information would be for each one an example of the fee that's currently the amount of the fee, and then how much it would be proposed to increase. Kind of like when you get a voter's pamphlet and you get to see the impact of a tax increase on the median income, like how much you would pay in a year. It would be good to see that here, so that we and the public can see how much are the fees and how much will they increase. That would be really helpful to me, at least.
There's another attachment on the website that shows each of our, if you go to the next slide, it begins that is available on the website. It's got our existing fees. We've got a few hundred fees. It's got the existing fees as they are currently. And I've got grayed out the scenario 1 and 2, which we did bring forward. And then the proposal that is circled in red is the proposal we brought forward today and was the preferred option. So it does list each fee, every single fee, and the proposed adjustments.
Okay, thanks. Because there's a lot of info there. Are there any examples you could pull out of an establishment so we could kind of get a grasp of what kind of fees are being charged? Common fees, ones that we could
Yeah,
understand.
food safety is the largest volume of fees by a wide margin. Food establishment fees range currently from $448 to $2,770. It's based on the complexity of their menu. And it's the $448 under this scenario is going to $469.
Yeah, just trying to highlight it there.
And this is an annual fee?
Yes, it's an annual operating permit fee. And then the highest, the 2,770 is going up less than 5% to 2,908. That's our establishment fees in the food safety program. No individual fee is going up more than 5% based on this model. We've held any fee from going up more than that. There are some fees going down, actually.
Septic fee thing.
Sure. So our drinking water fees are going down 7.84%. The revenue is going down 7%.
Yeah, so where's it break? It's the next page.
You can keep going, advance. There's school health and safety. You've got fees there going down and some going up. That's drinking water protection, and you'll see there the fees are all going down around 7.9%.
Thanks for this. Like an example, what is a septic fee? How much is it now?
So the septic permitting fees, it's based on activity. There's not an operating permit in that program. There is an on-site septic operations and maintenance program. That's where there's an annual permit for septic owners. Sorry, 1 second.
Looking for the O and M.
It's towards the back.
Keep going. I think it's.
So the septic operating permit currently, this is all septic owners pay this.
There you go.
Yeah, currently it's 1321. It's scheduled to go to 1387. Last year, or for this current year, we added the non-compliance fee. Those septic owners who are not compliant with the required inspection schedule, they pay an additional fee. That's going from 2332 to 2448, for example.
Okay, no, that's really helpful for me. Sorry about all the questions.
That's fun. I think it's good to know what the individual impact of all of this would be, but the policy has been 100% cost recovery. So, and we'll see Jeff come back to us annually.
Yeah, this is a very critical part of our budget. We have a very challenging budget structure already. So getting where we can, getting our funding indexed, and this is cost-based. This is huge for us.
Any other questions? Just go ahead.
Yes, just a couple of things. One is, and I appreciate Council Little's question because I take it a little bit further in that, I see the dollar amount of the change. What I don't know is what the impact is to the industry or to the fee payer. So what are we doing for outreach to communicate with the community on these fees?
Yeah, we've actually met with the technical advisory committees for on-site septic, drinking water, and food safety. And we've been having meetings with the school health and safety technical advisory group. So yeah, we've met with them. That's part of our annual process. Nobody has lobbied against scenario number 3, which is where we're subsidizing the fees.
Okay, and have we received any feedback, any emails or anything? Okay,
Nothing.
great. And then I appreciate the slide. I think it's the notes of interest. May have been. You did a good job of explaining the cost increases, but I'm wondering if perhaps by the time we have a public hearing, if you could give a little bit more detail in terms of what the cost increases. So like, for example, like personnel costs, there's some related to increasing costs of that in the Me Too clause, but were there any added FTEs? Just a little bit more clarity. You know, how much have our expenses gone up for consumable items that we use or for tools, equipment, things like that? Just a little bit, not like a full line item budget, but
Yeah.
just some of the bigger things that have contributed to that. And then, and I also trust and believe that you've done your due diligence to see where we can become more efficient. So any of those efforts that you've made to try to keep the costs down low rather than just raising them. So
Yeah.
that I think would provide a great information base for people to understand the need for the increase in the fees.
I should actually comment, that's such a great point. These fees are based on 8 positions being eliminated from the public health budget, 2 of which are in the environmental public health division.
It's important to know.
Yeah, public health nationally has a broken budget construct. It's not unique to Clark County. It's not unique to Washington State. Revenues at best are flat. Our costs obviously go up. I think I've said this to you guys before, maybe it was a prior board. I came here in 1998. At that time, we have a federal maternal child health block grant. At that time, it was $334,110. I know that number because today it's $334,110. The state actually appropriated $1,767,341 for us beginning in state fiscal year 2014, and that was a statewide funding source. I know that number because today it's the exact same figure. So it's not a manageable budget construct.
Yeah, and I think those are important things to get out there to the public. Not everybody's going to read it, but if they choose to and want to know why the fees are increasing, they can go back and see that information. Thank you.
Are there any other questions? Okay, thank you. And I do think that the council is interested wherever we have cost savings, that's an important context to have when we're developing any increases as well as the additional costs that we're facing. So I appreciate your comments on that. Okay, no other questions. Thank you very much for the information. Do you need any further guidance from us or?
I think
you're
that was good.
Great.
Thank you.
Thank you.